This conference will now be recorded.
Everyone, on behalf of Sheila, madam, please switch off your mic for
Okay, sir.
Good afternoon, everyone. I, on behalf of Shreyas E-Learning Academy, welcome you all in this next session of Arsha's seminar. I welcome our today's speaker, Dr. Madhuri Bhandare, madam. She is MS Shalya Tantra and currently working as an assistant professor in Shalya Tantra Department, R.A. Poddar Medical College, Worli. Madam has done her BA MS from Government Ayurvedic College, Nanded, and MS from Government Ayurvedic College, Usmanabad. Now she is pursuing PhD degree at R.A. Poddar Medical College. Madam has total teaching experience of 10 years, PG guide experience 14 years, PG guide experience is of 10 years, and much more than that, practical experience of more than 15 years in this field. And madam has published more than 6 research papers in various international journals. So, without taking much of her time, we will like to start our today's topic, that is Arsha and local procedure. I welcome you, Dr. Madhuri madam, and we would like to hear your thought about this today's topic. Thank you very much for accepting invitation, and over to you, Dr. Madhuri madam.
Thank you, sir. Thank you for such a nice introduction. I will share my PPT. And it's a pleasure to be here. Our today's topic of presentation is Arsha and local procedures. Objectives of today's presentations are to study the hemorrhoids, to understand the indications and contraindications of local procedure, to know the local procedures in hemorrhoids, and the procedures which can be done in OPD and daycare centers. So, what Hippocrates said, what is hemorrhoid, what he described, that if a bile or phlegm be determined to the veins in the rectum, it heats the blood in the veins, and these veins becoming heated attract blood from the nearest veins, and being galled, the inside of the gut swells outwardly, and the heads of the veins are raised up, and being at the same time bruised by the feces passing out and injured by the blood collected in them, they spit blood most frequently along with the feces, but sometimes without feces. Just focus on just 2 things, that is, it is just a swelling of the hemorrhoidal veins or veins, and it oozes the blood. So bleeding and the swelling of the veins. These are the more important features which Hippocrates described in that era also. And today we will also see that these are the main symptoms of the hemorrhoids. What Ayurveda told about the Arsha, Ayurveda defined it in a various manners. I just enlist in them. It troubles some like an enemy. Means it troubles the patient like an enemy. Susuda said it is Arivata pranana hanti. Means Ari means Shatru. Shatru pramane ha apल्या प्राणांचं हनन करतो. So it troubles like an enemy. So it is called as Arsha. And its appearance is like Mount Sangpur. So it is called as Arsha, as it looks like a Mount Sangpur. It also obstructs the anal passage. The main vein of the anus is affected. The friction aggravates the symptoms, and bleeding may cause anemia. So, आपण पाहतो की अर्शाच्या उपद्रवामध्ये पांडूचं वर्णन आहे, बिकॉज ब्लीडिंग मे कॉज एनिमिया. ते आपल्याला संहितेमध्ये सुद्धा पाहायला मिळतं. व्हॉट आर हेमोराइड्स? Hemorrhoids is a Greek is derived from the Greek word that is hema, means blood, and truce means bleeding or flowering. So the bleeding is the main symptom of the hemorrhoids. So it is called as hemorrhoids, and it is derived from these two Greek words. Bile. Bile is derived from the Latin word that is pila. Pila means ball. It looks like a small ball. It is a round shaped structure and it looks like a small ball. So it is called as bile. What are the etiological factors? Modern and Ayurvedic science both are well described the etiology of the hemorrhoids. In modern, I just enlisted. It is one of the most important cause of the hemorrhoid is hereditary. Means always patient gives most of the time patient gives the family history of hemorrhoids. Means mother or father is suffering from the same problem or hemorrhoids. Absence of balls in the superior rectal vein it is also the important morphological cause of hemorrhoids. Staining, diarrhea, constipation, hard stool, low fiber diet is again the one of the most important factor which ultimately causes the constipation and hard stool, and it will leads to the prolapse and hemorrhoids. Overpurgation is also important because patient took the medicine for a longer period like laxative, purgative. So overpurgation also causes the prolapse of the anal cushions and it will lead to hemorrhoids. So, pregnancy. In pregnancy, due to increased progesterone level, the muscles, that is internal sphincter muscles, relaxes and so it will lead to the hemorrhoids. CA rectum is one of the important cause for hemorrhoids. Portal hypertension is one of the most important cause of hemorrhoids because the portal venous system is connected to the superior rectal vein, that is which are the hemorrhoidal veins, branching of the hemorrhoidal veins, because hemorrhoidal veins branch into the superior rectal vein. These are nothing but the radicals of the superior rectal vein. So these systems are connected. So portal hypertension ultimately leads to the pressure or congestion on the hemorrhoidal veins and it will cause hemorrhoids. Ayurveda told the very important etiological factors of the arshas, that is viruddhasana. Viruddhasana, Sri Prasanga, Utkatasana. Utkatasana means squatting for a longer period. Then Krushthayan. Krushthayan means riding of animals. So in today's era, we can compare with bike riding also. So bike riding for a long period is also the important cause of hemorrhoids. Then Vegavarud. Vegavarud causes the constipation and ultimately leads to the hemorrhoids. Hemorrhoidal appearance is may be mucosal or vascular. It may be mucosal or vascular. Mucosal means just prolapse of the mucosa of the anal cushions. So it looked like just a prolapse of the mucosa. And in vascular appearance, the vessel prolapse, or we can see the bulge of the vessels clearly. So this is a vascular variety or vascular appearance. Modern science classified hemorrhoids in a various manner. And one of the classification among them is the internal hemorrhoids, external hemorrhoids, and external hemorrhoids. Internal hemorrhoids, when these are present above the dentate line, you can see here the internal hemorrhoids, picture of internal hemorrhoid through the proctoscopy. When it is present above the dentate line and it is covered with the mucous membrane. So these are called as internal hemorrhoids. And when external hemorrhoids, when these are present below the dentate line and covered with the skin, then it is called as external hemorrhoids. So you can clearly see here, these are covered with the skin and present below the dentate line. We can't see here dentate line. We can see it through the proctoscope, but these are present below the dentate line and these are covered with the skin. So these are the external hemorrhoids. And internal-external variety means when these two conditions, that is internal hemorrhoid and external hemorrhoid, when these two conditions occurs togetherly, then it is called as internal-external variety. Means here we can see these are the internal hemorrhoids. 3, 7, 11. These are the internal hemorrhoids, and these are connected with the external hemorrhoid also. So these are the external variety. Another classification as per modern science is depends on the morphology of the anal canal. So in this classification, anal cushions are the important structures. The anal cushions are nothing but the aggravation of the blood vessels, that is arterioles and venules, smooth muscles, elastic connective tissue in the submucosa that normally reside in. And the the sides of these anal cushions are 3 o'clock, that is left lateral, 7 o'clock, that is right posterior lateral, and 11 o'clock, that is right anterior lateral. So in this classification, when the hemorrhoids present at 3, 7 and 11 o'clock, then these are called as primary hemorrhoids. Because 3, 7 and 11 o'clock positions are of anal cushions positions, as we have previously seen in previous slides. See, these are the sides of anal cushions. And when hemorrhoids occur at these sides, that is 3, 7 and 11, then these are called as primary hemorrhoids. Here we can see this is 3, this is 7 and this is 11. These are the primary hemorrhoids. So, and these primary hemorrhoids are related to the branches of superior hemorrhoidal vessels or superior rectal vessels. Then, secondary hemorrhoids. When the hemorrhoids present in between these two anal cushions, means 3, 7 or 7, 11 or 11 or 3, then these are called as secondary hemorrhoids. Here we can see this is 3 o'clock, this is 7 o'clock and this is 11 o'clock. Between these 3 and 7, there is one of hemorrhoid, that is secondary hemorrhoid. Here also between 11 o'clock and 3 o'clock, there is one hemorrhoid. It is called as secondary hemorrhoid. Secondary hemorrhoid is rare as compared to primary hemorrhoids. Then another classification, and which is very important according to actually for the therapeutic use. And these are also called as the degrees of the hemorrhoids. And the treatment also depends on these degrees. So it is also important therapeutically. Ayurveda didn't mention the degrees of hemorrhoids. Modern science explain it in a well manner. In first degree hemorrhoids, when the piles doesn't come out of the anus, piles is there or bulge is there or inflamed swelling of hemorrhoid is there, but it is present only in the anal canal and you only can see it through only proctoscopy. So in this first degree, piles doesn't come out through the anus. In second degree, prolapse during defecation, hemorrhoidal prolapse during defecation, but returns back spontaneously. So after defecation, it will goes in the anal canal spontaneously. In third degree, it prolapsed during the defecation but return back only manually. Means patient should reduce the hemorrhoidal mass in the anal canal. Then only it will reduce. Otherwise, it will not reduce. So there is a need of manual reduction in the third degree. In fourth degree, it is permanently prolapsed. Means if we can't reduce this hemorrhoids. When we can't reduce, these are the prolapsed hemorrhoids of 4th degree hemorrhoids. What Ayurveda told about the classification of hemorrhoids, that Sushruta describes 6 varieties of hemorrhoids. Vataj, Pittaj, Kapaj, Raktaj, Tridoshaj and Sahaj. These all varieties we can correlate with today's modern varieties, that Vataj variety we can correlate with external hemorrhoids because Vataj arshas are Shah-Varun in color. So external hemorrhoids are also covered by the skin. So these are Shah-Varun colored. So we can compare Vataj arsha with the external hemorrhoids. Then Pittaj arsha we can compare with blue colored muscular swelling because Pittaj arshas are bluish in color. So when the piles are in blue color, when swelling is more muscular, so these look like bluish colored, so we can compare it with Pittach Arsha. Then Kaphaj Arsha, when patient complains of mucoid discharge, itching, then these are the symptoms of the kapha. Hai na? Discharge and itching is the symptoms of kapha. So we can correlate with these arshas with Kaphaj Arsha. Then Raktaj Arsha. We can compare bleeding hemorrhoids. See, all the hemorrhoids has a bleeding, one of the main symptoms. But some hemorrhoids bleeds heavily. So these hemorrhoids we can compare with Raktaj Arsha. Then Tridosha Arsha. Tridosha Arsha, when hemorrhoids becomes complicated, is when it becomes inflamed, thrombosed, internal-external, then thrombosed, internal-external, then we can call it as Tridosha Arsha. Then Sahaj Arsha, when there is a history of heredity, that is family history, maternal or paternal, then it is called as Sahaj Arsha. Then clinical features of hemorrhoids. Prevalence of the hemorrhoid is 4.4% in the world, but in India it is near about 50%. Then age group, it is common in 30 to 65 years. It is common in both gender, that is male and female. Bleeding is the first symptom of the hemorrhoid. So bright red and fresh colored bleedings during defecation is the first symptom of the hemorrhoid, and bleeding is in the form of splash in the pan. So it is like a drop by drop bleeding. It splashes in the pan. Then another important symptom is mass per annum. When hemorrhoids becomes second, third and fourth degree, then it protrudes through the anus. So mass per annum is one of the complaint of patient. Then there may be a mucoid discharge. Then pruritus. Anal pruritus is also a common symptom of the hemorrhoids. Then pain. Actually, hemorrhoid is a painless condition and it becomes painful only when these are prolapsed and get catched by the sphincter muscle. When these are infected or it becomes thrombosed or there is a spasm of sphincter muscle, then only these are painful. Otherwise, this is a painless condition. And there is a severe pain in thrombosed hemorrhoid. So, pain is only in the complicated conditions. So, inflammatory or thrombosed, or if there is internal sphincter spasm or external sphincter spasm, then only the pain is there. And secondary symptom of bile is anemia due to the excessive bleedings. So, how will you diagnose hemorrhoids on examination? First of all, inspection. So we can see only prolapsed hemorrhoids and external hemorrhoids on the inspection. When these are not prolapsed, when these are in the first and second degrees, we can't see it in the perianal region. Okay. Then we can also see the thrombosed hemorrhoids at the anal region. So we can see if these conditions are present, that is prolapsed, external or thrombosed hemorrhoids, then only we can see it through the inspection. And we can also see associated diseases like perianal abscess, perianal hematoma, skin tags, fistula. So we can also see the associated diseases when we are examining the patient for hemorrhoids or during PR examination. Then for digital examination, when we palpate or we do the PR with index finger, we can't feel the hemorrhoids because these are a very soft mucous structures. So normal hemorrhoids means hemorrhoids we can't palpate in the per digital examination. They didn't feel to our finger. So only in case of thrombosed piles, they can be felt. They can be, not always. Means नेहमीच ते आपल्याला लागतील असं नाही, थ्रोम्बोज असेल तरी, but sometimes they can be felt. But एक लक्षात ठेवा की नेहमी पर डिजिटल एक्झामिनेशन मध्ये तुम्हाला ते हिमोराइड्स फील होत नाहीत. Then proctoscopy. So proctoscopy is one of the most important examination to diagnose hemorrhoids. So what we can see through the proctoscopy, we can see through the proctoscopy exact position of the hemorrhoids, how many they are, means numbers, these are 2 or 3 numbers, degrees. Actually, we can decide the degrees through the history also, but after a gross experience, we can decide it through the examination also. So बऱ्याच वेळा ऍक्च्युली हिस्ट्रीच इम्पॉर्टंट आहे डिग्रीसाठी, पण खूप तुम्ही PR एक्झामिनेशन केले, प्रोक्टोस्कोपी केले, त्यानंतर सुद्धा तुम्ही फाईल मास पाहून तुम्हाला डिग्रीज कळतात. ओके, सो हिस्ट्री अँड इन्स्पेक्शन बोथ आर द important to decide the degrees. And size means they are big or small, and the surface and appearance means these are ulcerated or bleeding spot is there or not. So we can see it through the proctoscopy, features and characteristics. Then differential diagnosis. So we should differentiate it from the CA rectum, because in CA rectum there is a hard growth you can feel through the index finger in per digital examination, exactly opposite to hemorrhoids. In hemorrhoids, nothing will feel to your index finger in the PR, but in the CA rectum you will feel a hard swelling in the PR. Then rectal prolapse, perianal warts and rectal polyps. Investigations. Hematocrit is important because it causes anemia. So if there is a need of blood transfusion, or also hematocrit should be done. Then colonoscopy to evaluate any proximal cause. Means proximally काही cause आहे, like ulcerative colitis, Crohn's disease. So if these are due to ulcerative colitis or Crohn's disease, so you can do the colonoscopy to evaluate that cause. Then complications. Profuse hemorrhage, which is the main complication of hemorrhoid, which may require blood transfusion. Thrombosis, when these are become obstructed in the spasm of the sphincter, then it will leads to thrombosis and it will turn into purple black color, become solid and tender. This is the painful and emergency condition of the thrombosis. It is one of the important cause, and we see it clinically most of the time in the OPD from those patients. Then ulceration. Ulceration is one of the important complication. Then it can leads to the gangrene, fibrosis, stenosis. Stenosis due to the prolapse of all the 3 hemorrhoidal masses or hemorrhoidal or hemorrhoids. If all 3 hemorrhoids are collapsed, so it can cause the stenosis. Then separations lead to, when it is become infected, when these bile mass becomes infected, then it leads to the separation, pus formation. So it can cause the perianal or submucosal abscess. Then it is a very rare complication, but it can happen. Then portal pyemia or pilophlebitis. As earlier I said that portal vein and the superior rectal veins are connected with each other, as superior rectal vein ultimately drains into the portal vein. So any infection in the hemorrhoids can go to the portal vein. So portal pyemia can occur. It is very rare, but it can be happen. Then treatment, which is a very important part of the hemorrhoids. And both preventive and therapeutic approach should be there to treat these hemorrhoids. So in prevention, more fiber diet and liquid diet is very important. In modern science also they mention the fiber diet, but Sushruta also mentioned various sharks, that is vegetables, in the hemorrhoids as a treatment part. So Fiber diet is very important. Then most of the liquids, laxative, then lifestyle alteration. So lifestyle is also means your sleep, your day routine, your eating habits, your sleeping habits. This plays an important role in forming the hemorrhoids. Then therapeutic. What is the treatment? Medical. First is medical. This is indicated only in first and second degree medical treatment. Then seeds bath, local applications like ointments, laxatives. It includes the medical treatment and antibiotics. Then parasurgical. Parasurgical includes sclerotherapy, banding, cryotherapy, IRC, that is infrared coagulation, laser therapy, which is famous today. Then Doppler guided hemorrhoidal artery ligation. I think you had a one of lecture on that part. Actually, I think Saranke sir completed all these topics, so I will not go in detail. And then surgical, that is open hemorrhoidectomy, closed hemorrhoidectomy, and segmental hemorrhoidectomy and anal stitching. Then Ayurveda also mentioned the holistic approach of treatment of hemorrhoids, that is Aushadhi, Shar, Agni, and Shastra. Now we will see, after completing the hemorrhoidal theoretical part, we will go to the local procedures, which are the important treatments of the hemorrhoids. Seeds bath, we can call it as Avgahan. So Sridhar Ibis has mentioned it as Avgahan. So plain water seeds bath, it should be a warm water, warm 20 minutes for 2 to 3 times. In text, it is mentioned as 20 minutes for 2 to 3 times, but 5 minutes for 2 to 3 times is sufficient. Not 20 minutes is a long period, so we can advise 5 minutes also. 5 minutes to patient. Then why seeds bath is important? It reduces the edema, pain, and promotes the healing. आपल्याकडे पण स्वेदनाचे जे गुणधर्म सांगितलेले आहेत तेच इथे आहेत. It reduces pain and promotes healing. Because seeds bath with a warm water is nothing but a svedana. So seeds bath is very important and plays a major role in the treatment of the hemorrhoids. Then seeds bath with medicated water. So some people put iodine, Dettol in that warm water or herbal dosha drugs or alum, that is Kangshi. But no need of any medicines. Plain water, plain lukewarm water is sufficient for all anorectal conditions. Only iodine, Dettol you can put after some surgery. There is also no need of putting iodine and Dettol. All these things. Plain water is sufficient for the seeds bath. In inflammatory conditions, Maxel, that is magnesium sulfate powder, we can add to the warm water. It has good results. We always prescribe Maxel plus warm water in inflammatory conditions, that is edematous hemorrhoids or thrombosed hemorrhoids. So you can add Maxel, but otherwise other drugs has no rules. In alum, that is Kangshi, we can add if the patient is of Raktajarsha or bleeding hemorrhoids. If patient is bleeding heavily, so you can add Kangshi to the warm water. Then local applications. There are number of local applications present in the market in the form of ointments, sprays, and suppositories. So these are all analgesic, anesthetic, corticosteroid, and nifedipine. Analgesics means diclofenac suppositories are used to reduce the pain in the inflammatory condition of the hemorrhoid. So you can insert the diclofenac suppository to reduce hemorrhoidal pain. Then anesthetic local applications. Lidocaine is the most important and popular anesthetic agent, which is heavily used in the hemorrhoidal or anorectal conditions. That is anesthetic, having anesthetic properties. So, corticosteroids are also used as an anti-inflammatory in the inflammatory conditions of the hemorrhoids. Nowadays, nifedipine is used with the combination of the anesthetic drug, that is lidocaine, as it relaxes the smooth muscle. So there are number of ointments in the market having anesthetic and nifedipine combinations. But these all have not much more role in hemorrhoids. Okay, because there is no pain and inflammatory condition is very rare, and we can treat it with other things also. So it has not a major role. What is the advantage of this application is to reduce the pain, edema, and itching. These are some well-known local ointments which are present in the market. This is lidocaine anesthetic. This is lidocaine plus hydrocortisone steroids. That is called, see, this is nifedipine plus lidocaine. This is herbal, that is Pilex. This is Anovate. It is also lidocaine plus corticosteroids. So these are some. This is also nifedipine and anesthetic agent. So we can give a better alternative to these local applications with Pichudhara. So we can give patient Pichu of Jatyadi tel, Ishtimatu tel, Tila tel, or Pasadi tel as per the condition. We routinely use Jatyadi tel for Pichudhara. So it will reduce the patient's pain, inflammation. Ishtimatu tel also has good results for the analgesic property. If you don't have any tel, then you can also give simple plain Tila tel. And Kasisadi tel is also analgesic and anti-inflammatory in nature. So there are various pains are mentioned in the Ayurveda, but I just mentioned what we routinely practice in Bodha. These are the instruments: tail, gauze, drivers, pad, bandage, etc. Just give a oil illuminated gauze, or just place a oil dipped gauze to the anal canal. जस्ट तो तेलामध्ये बुडवायचा आणि तो गॉज तिथे प्लेस करायचा आणि पेशंटला सांगायचं जेवढं जास्त शक्य होईल जेवढा वेळ तिथे तो राहू दिला पाहिजे. यू कॅन गिव्ह अ बँडेज एक्सटर्नली ऑल्सो. वरून वाटलं तर स्टिकिंग वगैरे पण पॅक ठेवून लावू शकता. सो देन अनदर इम्पॉर्टंट थिंग फॉर to treat these hemorrhoids is yoga or exercise. So Kegel exercise. What is Kegel exercise? To hold the sphincter, anal sphincter tightly is the Kegel exercise. पेशंटला सांगायचं की ड्युरिंग मॅच्युरेशन जर आपल्याला मॅच्युरेशन होल्ड करायचे असेल तर तुम्ही जी ऍक्टिव्हिटी करता ती तुम्हाला करायची Kegel एक्सरसाइज मध्ये. सो इट विल गिव्ह गुड रिझल्ट. इट विल गिव्ह स्ट्रेंथ टू द मसल्स ऑफ कुशन्स. It is nothing but the Mula Bandha which is mentioned in Ayurveda. Then exercise means routine exercise, that is yoga or walking, will help to treat hemorrhoids because exercise doesn't cause the constipation. It will remove the constipation. It will activate the intestine, so there is no constipation. So there will be hemorrhoids. What are the advantages of this yoga or exercise? It enhances the muscle tone, it increases the circulation, and it minimizes the prolapse. These are the benefits or advantages of the yoga exercise. Then next local therapy, and which is very important therapy, is injection therapy or injection sclerotherapies therapy, which is very famous and which is favorite of surgeon and patients also. So it is a OPD procedure. We can do it in a OPD procedure. Indications are: first, degree and early second degree hemorrhoids. All three piles can be injected separately, can be repeated after 6 weeks. Means next sitting we can give after 6 weeks. It causes fibrosis in the mucosal region and thereby fixation of the anal cushions and obliteration of the lumen. It is the mode of action of this sclerotherapic agent. Then it is quick and painless. Time consuming nahiye, and it is painless procedure. Because why it is painless? Because it is present above the dentate line. So hemorrhoids in first and second degree, these are present above the dentate line, and we inject the drug in above the dentate line. So above the dentate line, it is painless area. So it is a quick and painless procedure. So there is no need of anesthesia, and cure rate is about 95% in first degree. So that's why it is popular in patients and surgeon also. It is inexpensive. Expenses are very less compared to other operative procedures. Routinely practiced in the hospitals. What are the contraindications when we can't give this sclerotherapy? In sepsis, where there is a sepsis means when there is an infective foci, so it can lead to the portal pyonia, one of the complications. So we can't do it in the sepsis or in complicated hemorrhage, that is thrombosed or prolapsed hemorrhage. Thrombosed or prolapsed hemorrhage, these are the third and fourth degree hemorrhages. So we can't do it in these hemorrhages because these are infected condition and these are again below the dentate line. So these are the painful condition, and these are the indications for the other things, that is hemorrhoidectomy and stapler, all these things. So we can't do it in the thrombosed or prolapsed hemorrhages. Then if there is a presence of proctitis, fissure, fistula. Fistula is one of the infective condition, and in fissure proctitis we can't insert the proctoscope in the anal column as there is a inflammation and spasm. So we can't, as we can't insert the proctoscope in the anal column, so we can't give the medicine. So these are the contraindications. Then in pregnancy, it is contraindicated. The drug is contraindicated for the pregnancy. Then diabetes mellitus. As there is a tissue immunity is less, so we can't give in the DM patients because it will cause infection. There are chances of infection in DM patients. What is the route of administration? Route is just inject in the submucosal plane, means in just beneath the mucosa. Just mucosaच्या खाली तुम्हाला ते घ्यायचं आहे, just above the anorectal ring to the pedicle. Anorectal ringच्या वर pedicle जिथं आहे, pedicle means the smallest part or जो neck like part जो आहे, that is pedicle. So तिथे inject करायचं आहे, and it is above the dentate line, so it will not cause pain. What are the complications? Recurrence rate is less, but it is there, that is 15%. Hypochondrial pain due to entry of drug into the portal system. If the drug is injected in the portal system, means you are not in the exact submucosal route and you inject it in the vein, so it can go into the portal system, and so patient can suffer from a hypochondrial pain. Then tenesmus means filling of the rectum. Tenesmus is one of the common complications. Mucosal sloughing or ulceration. Then submucosal abscess. It is very rare, but it can happen. Submucosal abscess if you inject deeply or if it is infected. Then anal canal pain, anal stricture. If all three be injected and if there is a fibrosis due to during the healing process and all three bile marks are injected and there is no any normal tissue in between the two hemorrhoids, so it can cause complete fibrosis and it will leads to the anal stricture. So you should take care of these things during the procedure. And the deep injection can cause pelvic abscess, prostatitis, impotence, rectovaginal fistula. These are very, very rarest things, rarest complications, but it can happen. The drugs used for the sclerotherapies In past days, 5% phenol in an almond oil is used for the sclerotherapy, but nowadays it is outdated. Now, Polidocanol 3%. The market name is Esclerol, it is famous, 3%, 2 ml injection having cost of 135 rupees is used to inject these hemorrhoidal veins, and the dose is 1.5 to 1 ml per hemorrhoid. It is a per hemorrhoid dose, 0.5 to 1 ml per hemorrhoid in plain or diluted form. You can dilute or not, but we are used to diluting. So dilute it with distilled water and you can inject it. 1 ml dilute in the 1 ml distilled water and you can inject it submucosal. We used spinal needle for this therapy because we can access through the proctoscope properly, as it is deeply, first and second degree hemorrhoids are deeply situated. Right? We can see only through the proctoscope. So if you used spinal needle, so you can reach at that site easily. So we commonly use spinal needle. Just remove the stellate. First stellate remove kara and this needle should be used. It is attached to the 2 ml syringe. आणि काय करतो, हे 2 ml syringe हे needle काढून टाकतो आणि इथं spinal needle लावतो stellate काढून and use this syringe to the sclerotherapy, because as spinal needle is having a more length, it will go deeply at the tip of the or at the pedicle of the hemorrhoids. So we need use spinal needle routinely. This is proctoscope. We should go through this proctoscope. You can use simple proctoscope or self-illuminated. Light source should be good in these procedures. Then xylocaine jelly or any ointment for the lubrication. This is the procedure where we inject the sclerosing agent, that is Esclerol. This is some of patients' photo. See, this is hemorrhoid and this we are injecting in the submucosal gland. Actually, this is a patient of fistula and he is operated for the fistulectomy and he has associated hemorrhoids. So it is actually under anesthesia. Patient is under spinal anesthesia. And so we are using small needle in this. So, see another picture after injecting some ml. Then, and this is the last picture. This appearance, this water balloon like appearance is the indication of the submucosal route. Means you are in it, you are in the proper route. You injected in the submucosal plane. It is indication of that. जर तुमचं सबम्युकोजल प्लेन मध्ये नसेल तर हे अपीयरन्स येणार नाही. सो balloon, water balloon like appearance is the indication of you are in the submucosal route. एक गोष्ट लक्षात ठेवायची देताना स्क्लेरोजिंग एजंट, ऑलवेज विथड्रॉ द पिस्टल. विथड्रॉ करूनच इंजेक्ट करायचं. जर विथड्रॉ केलं आणि ब्लड आलं तरी इट मीन्स यू आर इन द हेमोरॉइडल वेन, यू आर इन द वेन. So don't inject. It will cause the portal complications. So always withdraw the drug. If blood is coming, then not push the drug. If blood is not coming, then you can push it. And lastly, this appearance is means you did it properly. This denotes you did it properly. Then next, this is sclerotherapy. Then next procedure, next local procedure is valence banding or rubber band ligation. It is also called as rubber band ligation. So it is indicated in second degree hemorrhoids. At one time, only 2 piles can be banded. Repeat banding only after 3 weeks. Band should be placed 2 centimeter above the dented line. Band आपल्याला हे 2 centimeter above the dented line is द्यायचे आहे, because as I previously said, above the dented line, it is a painless area. So always banding should be above the dented line. That's why only it is indicated in the second degree. Okay. Usually 2 bands are used for pile mass to take care of blockage. Means एक तुटलं तर दुसरं राहावं म्हणून 2 bands should be inserted or placed at the pedicle. It causes ischemic necrosis and piles of. Due to banding, its blood supply is hampered, so it causes the ischemic necrosis and piles then fall out. Tissue sloughs off in 1 to 2 weeks, leaving an ulcer which heals by scarring. So tissue slough out hoto after 1 to 2 weeks, hemorrhoidal tissue, and then it will heal simultaneously. Okay, so these are the indications and mode of action of the rubber band ligation. What are the advantages of rubber band ligation? It is inexpensive equipment. It is cost effective. Then simple to perform. Procedure is simple, easy. Then as it is above the dented line, there is no need of anesthesia. So it is a OPD procedure and it has consistent results. It has also consistent results. And it stops bleeding and tackle the prolapse in anal push-ups. This is Barron's gun. You can see it. This is ligator, this part, and this is loading cone. We load the rubber bands with this loading cone to the ligator. I will show you one video. And this is grasping forceps. This grasping forceps should insert through this ligator, and then from this tip, catch the affected part of hemorrhoid. You want to rubber band or banding, catch it with it, and then just shoot with it. So it will place the rubber bands at the base at the pedicle of the hemorrhoids. So I will show you one of the video. These are the rubber bands which are used for the rubber band ligation. See, this is the procedure. I think it's not. See, I think video is not playing. So, I will repeat it. This is a ligator. This is a loading cone. So, through this cone, rubber bands are placed here. Okay. First attach loading cone, then rubber bands are placed here. Then remove the loading cones, and then with this grasping forceps, insert this grasping forceps through this ligator, catch the hemorrhoid, then place the ligator at the base of the hemorrhoid or pedicle of the hemorrhoid, and then just shoot it from here. Video is there, but it is not able to play. So, it's okay. What are the disadvantages of rubber banding? If it is applied low into the skin, means below the dented line, it will cause a severe pain. As I said, below the dented line, there are the somatic supply of nervous system. So, below the dented line, it is painful area, and above the dented line, it is painless area. So, if you placed it below the dented line, so it will cause severe pain. So, low strength of the quality bands. Quality bands are not available in the market. We are always facing the same problem of the quality of the bands. So, after 1-2 days, patient came with the broken bands or bleeding history. So, this is the major disadvantage of rubber banding. Then less availability of the quality bands. Availability of the bands is also very less. It is not easily available in the market. Then discomfort due to the rubber band ligation of the hemorrhoids in the anal canal. Patient feels discomfort. Then secondary hemorrhage. If the rubber band is broken after 1-2 days, then secondary hemorrhage is the main complication of this, or main disadvantage of this rubber banding. Then it can go in ulceration, fissure, and proctoplasty. Why? Because we can't insert the proctoscope. Because you should insert the proctoscope first, and then you should insert this Barron's gum. So in this condition, we can't do these things. So it is contraindicated in this case. What are the strengths of the Ayurveda? Now we have completed the modern part of the local procedures. What Ayurveda said about the local procedures? Which are the strengths of the Ayurveda? These are the Nepal, Bhudapuran, or Matravasti, Kshad Karma, Agni Karma, and Jello. Lep. Sushruta described various herbal herb combinations for lep. Some of among them, some of here, Snowy Kshir plus Haridra, Gujja, Danti, Chitram, etc. Okay, Sushruta told it in the Varsha Chikitsa. It is indicated in first and second degree hemorrhoids. We routinely not practicing this practice. It is a OPD procedure, so no need of anesthesia, as it is also in the first and second degree hemorrhoids, and it is above the dentate line, so no need of anesthesia. It requires multiple sittings. So fine shade of होने तक हमें ये apply करना पड़ता है. So it requires multiple sittings. Results are not so promising. Need more research. So we are not routinely practicing. So I think South people are practicing it more. Then Bhudapuran and Matravasti. Instruments, you can use rubber catheter, then feeding tube also. It is not mentioned here, but you can use feeding tube also. Tailor, any medicated tail. I will mention later on. Then lignogen jelly for lubrication or any type of lubrication you can give it. Then drugs. Which drugs we routinely use in practice is Zatyadi Tel and Ishtimadu Tel and Tilatras. We use Zatyadi Tel and more commonly in hemorrhoids patients for Bhudapuran. Ishtimadu Tel is also good. It has also good results. You can use Ishtimadu Tel also for Bhudapuran. If you don't have these both tails, a patient is not so according, so plain tail can be used, and it has also good results. So, what is Bhudapuran and Matravasti? What is the difference between Bhudapuran and Matravasti? When the dose is less, then we called it as a Bhudapuran, and when dose is about 100 ml, that is the dose of Matravasti. So we called it as a Matravasti. So in Bhudapuran, we use 10 to 30 ml of Tela for Bhudapuran, and for Matravasti, 100 ml. Matravasti mainly we are used for of Tila Tela. We use Tila Tela for Matravasti, and Zattari Tela and Ishtimadu Tela for Bhudapuran. What are the advantages of Bhudapuran or Matravasti? It reduces the pain in hemorrhoids. It is anti-inflammatory in action. It reduces the inflammation. It gives softness to the tissue. It gives oleation, and it also enhances the tone, as it is a Shaitilya. Snehan is Shaitilya. So it reduces or it enhances the tone. And it gives oleation, sleep the gum, and gives softness to the anal canal. So this is the video of Matravasti or Bhudapuran. I think it is not working. Both videos are not. Then another karma is the Shava karma. So it is indicated in first degree and early stage at the second degree. Commonly used ksharas are Apamarga kshar, Kadali kshar, and Palat kshar. pH is among 9 to 11, as these are all the kshar. So Apamarga kshar is more commonly used kshar. We routinely use Apamarga kshar for all kshar therapy, and it is easily available in the market also. So Apamarga kshar is commonly used kshar. In this condition also, there is no need of anesthesia, because we are we are placed the kshara or giving the application of kshara to the first and second degree of the hemorrhoid. So these are also above the dentate line, so there is no need of anesthesia. It is a OPD procedure, easy procedure. it requires 3 to 4 sittings or can be more sittings. Then results are not so promising. We routinely didn't practice it. But I think South people's practicing more this Ksharatharma. These are some pictures before. This is before Ksharatharma, drying mass, and this is the next Ksharatharma. It becomes awareness, then it will shade out. Agni Karma. Next local procedure is Agni Karma. It is also indicated in the first and early stage of second degree. We routinely not practicing, and I think surgical people are not routinely practicing. It is a OPD procedure. No need of anesthesia, as it is above the rented line. It requires 3 or more settings. Results are not so promising. It needs more research. There is a very less research of Agni Karma. So it needs more research. But this infrared coagulation, IRC and cautery and laser is the modern form of this. These are nothing but the Agni Karma. You use Agni, some energy here. So we can compare it with these modern things. Next local procedure which is important and we routinely practice, that is Jello culture. What are the advantages of Jello culture? We can use it in the prolapsed, inflamed, hemorrhoids. See, previously most of the procedures are for only first and second degree hemorrhoids, but Jello, we can apply the leeches to prolapsed or inflamed and thrombotic hemorrhoids also. So, this is more important, and this leech application reduces pain. It acts as anti-inflammatory and it is inexpensive. Expenses are very less for this procedure. And this is also OPD procedure. Less instrumentation is needed. Instruments खूप कमी लागतात. And you can do it at any time. So, no need of that means particular time is not indicated. As per patient's convenience, you can do it at any time. Then what are the materials needed for leech therapy? That is leeches is the main material. Then cotton and gauze piece and haridra. This is missing here, but haridra should be there of the post-operative or post-procedure. Then disadvantages. Disadvantages for leeches is very less. Only the availability of the leeches is the big problem. So leeches are not easily available. If these are available, then there is no issue. But availability of the leeches is the main disadvantage of the leech therapy. Then bleeding. This post-procedure bleeding, as leeches secretes hirudine and it is anticoagulant, so bleeding, and these are the vascular structures. So there may be bleeding post procedure. But we routinely practice it. There is not excessive bleeding. Bleeding is there, but we can stop it in our basic treatments. So, only in, but it can be a main complication. So just look for that. Jello culture. These are the patient's pictures. This is thrombotic hemorrhoid pre-procedure. Previously of leech therapy of Jello culture. This is during Jello culture. This is just after the post Jello culture, post leech therapy. See, bleeding is not very excessive. And this is the end result. See, this is thrombotic hemorrhoid. It is pre-procedure. So during leech therapy, this is just after leech therapy, that is post-Jello culture. This is the end result. So leech therapy is very important and it is very potent therapy for the hemorrhoids. Thank you. Any queries? Hello? Hello, Chintan sir?
Oh,
हाँ सर,
Hello,
आवाज येते?
yes, thank you very much, madam. It was a very nice presentation, and all the delegates will be very benefited from the knowledge that you shared. I, on behalf of Shreyas E-Learning Academy, thank you again for your valuable time.
I was not able to show you video. There are some good videos also, but it's not played actually.
Madam, what you can do is you can share those videos first, then we can send it
Okay,
to
sir.
afterwards.
Okay, sir.
Yes, madam, there are 2-3 questions in the
Okay,
Can
sir.
you access them?
Yes, sir. For sclerotherapies and spherical See, you can use slit proctoscope also, but it is painful, sir, because we are doing it in a OPD procedure. This patient is not under anesthesia. If he is under anesthesia, like local or pedicudendal or spinal or saddle, you can use slit proctoscope. But otherwise, it will give some pain to patient. So, our simple proctoscope is good for the sclerotherapy. Because it doesn't hurt the mucosa of the anal canal and rectum. Clear, sir? Yes. I heard that most of the participants are from practice. Most of the participants are practitioner. So you can use sclerotherapy and rubber bandaging in your daily practice. But in initial stage, you should be under some observations of expert. एक्सपर्टला कोणाला तरी बोलून तुम्ही सुरुवातीला करा सर. म्हणजे 7-8 वेळा तरी कोणाच्या तरी एक्सपर्टच्या अंडर and then you can do it routinely because these are the easy procedures. This only need the skills.
Yes, madam. Those were the questions. Yes, thank you very much again from Shreyas E-Learning Academy for accepting our request and presenting such a nice and elaborative presentation.
Thank you so much, sir.
Yes, thank you very much.
Can I leave now? Thank you.
Yes, madam.
Achha, another question is there, I think.
Yes, you can take
For
that question.
sclerotherapy. Yes. Sir, for sclerotherapy and rubber banding also, lithotomy is the best position for all procedures, sir. You can do it in lateral position also, but lithotomy gives you a better picture for all surgeries and parasurgical methods also. So lithotomy is the best position.
Yes, madam. Yes, thank you very much, madam. Kindly
Thank you so much.
do share your videos. We will share them to the delegates.
Okay, sir. I will try.
Yes, madam. Thank you.
Thank you so much. Can I leave now?
Yes, madam.
कहीं भी रहता है हम फिर खराब हो जाता है इससे मशरूम